Today we are going to talk about ectopic pregnancy. We all know that the sperm fertilizes the egg, which happens in the tubal part of the uterus, in the uterine tubes, and then implants itself inside the uterine cavity. But what happens during ectopic pregnancy? During ectopic pregnancy, this fertilized egg and the developing embryo is not allowed to reach the uterine cavity. So it gets implanted at abnormal places other than the uterus. 90% of the ectopic pregnancies are tubal pregnancies. And mind it, ladies, these have a fatal outcome. These pregnancies usually present with patient of a reproductive age, comes with the history of a delayed period, severe abdominal pain, which might sometimes even lead to patient with fainting attack, and followed by a vaginal spotting, which may or may not be there. This is mentioned as the triad of ectopic pregnancy. It is also said that any woman of reproductive age, if she presents with severe abdominal pain, then we should always consider ectopic pregnancy in our differential diagnosis, taking into account the history of delayed period. How do we diagnose it? It's very easy to diagnose ectopic pregnancy by a transvaginal ultrasound and the beta HCG levels. Why are we talking about ectopic pregnancy today? Because this ectopic pregnancy, if not diagnosed timely, can lead to tubal rupture, which might end into septic shock and even death of the patient. About 10 to 15% of maternal deaths in the first trimester are because of ectopic pregnancy. So every lady should be aware about it. What are the risk factors which lead to this ectopic pregnancy? It is generally history of pelvic inflammatory diseases like chlamydial infections, which most of our ladies do not get treated, thinking that leukorrhea or white discharge is just a normal phenomenon. So they don't get a pap smear done, they don't visit a gynecologist. And another, history of assisted reproductive techniques. These patients generally present with infertility and they go to a gynecologist or an infertility specialist for this IVF procedures. These IVF procedures may sometimes or most of the times may lead to ectopic pregnancies. So it is very important to treat the pelvic inflammatory disease. How do we manage it? It is easily managed if diagnosed timely. If it is not diagnosed timely, patient may land up in the ICU and may have to be put on a ventilator also. So, my dear girls and ladies, remember that whenever there is a history of delayed period with severe abdominal pain, try to prevent this emergency and visit your gynecologist.